if you're making your incisions at the right angle, parallel with the existing hairs, then the chances of damaging the follicle are pretty low, because you're seeing the sort of cross-section of each of the hairs.
And shaving the head obviously helps hugely with this.
I always try and shave the head with that sort of situation. But let's imagine you make your incision to the wrong angle, then with every pass of your blade, you're potentially transecting 3 or 4 hairs. And statistically speaking, you're far more likely to damage the hair because you're going in sort of transversely rather than in a cross-section. So the angle of incisions is the most important, and obviously you operate using magnification. You can see the exit angle of the hairs. You're experienced enough to know that sometimes the exit angle isn't quite the same as the angle it is under the surface of the skin, and you would allow for that a little bit, which takes experience to know. And I genuinely I can't recall a time I've had significant shock loss in a recipient area, just using those steps. I think the blade is quite important. I use a sapphire, which is super sharp and causes minimal surrounding tissue trauma. So it sort of glides in and out like butter, and it's not like I used to use a stainless steel blade, which you get a lot of puckering, and every 100 or so incisions you'd have to change the blade because the skin started dipping in every time you made your incision, and that disrupts things. And